Getting ready for the meds round. The equipment you'll need will depend on what you are administering, such as tablets, liquids, creams, but also the person's preference. Oral medicines may need medicine spoons, cups, or oral syringes. To clean any equipment, we need to ensure we're washing them in warm, soapy water and leaving all items to air dry. We never dry them with a paper towel or a towel. With syringes, there is often confusion about how often we should change them or how long we should keep them for. As per NICE recommendations, syringes for oral medication can be used until the markings start to fade. To wash an oral syringe, we need to draw some water in and out of the syringe a few times. Items for the medication round should never be washed in a dishwasher or sterilizer. Next, check the medication documents. As well as medicines charts or MAR charts, there may be other medicines documents to refer to, such as administration profiles, body maps for creams and transdermal patches, and also when required protocols. It's important when administering medication that we check the individual's identity. If you don't know the person, ask their name, check the photographs contained on the MAR chart, or ask another member of staff for information. Next, we must always start with the chart. The Medicines Administration Record, more commonly known as the MAR chart, lists and records the medicines a person takes or uses. The exact way you work with the medicines chart will depend on the format of the chart you use, whether it's paper or electronic, and also the individual design. It may sound obvious to check the MAR chart first. However, once you've administered medicines to the same person a few times, there is temptation to not start with the chart, as you will quickly learn what medicines they have. This is where mistakes happen. Doses and directions may change, medicines might have been stopped, or new medicines added and prescribed. Hence, we make the following checks. We check to see how many charts there are. We then check to see which medicines are due at that time. We then check to see if any medicines need to be given with or without food. We also check to see if the dose has already been given or taken. We then check to see if the last dose was recorded correctly and that sufficient time has passed before we administer the medication again. We need to remember to carry out the 7-point check prior to administering medicines. Number 1, check the client's name. Number 2, check the name of the medicine. Number 3, check the strength of the medicine. Number 4, check the form of the medicine. Number 5, check the directions. This could be take one daily. Step 6, check the medicines inside. Step 7, check the expiry date. Prior to each medication round, ensure you wash your hands thoroughly under warm running water with soap and dry your hands with either a hand dryer or a paper towel. As normal, staff members administering medication should be bare below the elbow, meaning short sleeves, no wristwatches, and a plain wedding band is acceptable. Staff members should never have nail varnish or false nails. Prior to each medication round, the trolley needs to be clean. We can clean our medication trolleys using either surface disinfectant wipes or antibacterial spray and a correct colour-coded cloth. Following each medication round, the trolley needs to be wiped down. Once the trolley is clean, we must prepare it with the appropriate equipment. Sufficient amount of water, cups or beakers, disposable medication pots, syringes, giving spoons, and antibac hand gel. Designated individuals will have the key to the medication trolleys. The medication trolley should never be left unlocked and unattended at any time. Questions are often asked whether gloves need to be used during the administration of medication. Gloves are needed if you come into contact with blood, bodily fluids, or broken skin. Gloves are not needed if you're administering oral medication or for eye or ear care, so long as there are no secretions present. Secretions could indicate that there is an infection. However, NICE guidelines recommend we need to take an extremely cautious approach and wear gloves if handling any cytotoxic medicines used to treat cancer. Gloves must be worn if applying topicals such as creams and ointments. When applying creams, ointments, gels or lotions, known as topical products, to the skin, it's best just to spread the product across the skin rather than trying to rub it in. Rubbing topicals into the skin doesn't achieve much, it just moves the product across the skin and can lead to irritation if you rub too vigorously. Examples such as hydrocortisone cream or fusidin cream are classed as medicated topicals and should be applied thinly. This means that you should be able to see the product through the skin and not much product is visible when on the skin. If you are applying steroid creams, then you use what's known as a fingertip unit measurement. A fingertip unit measurement should be enough cream or ointment to cover 2 hands worth, including the fingers, of skin. Remember, upon first opening a topical medication, the date of opening needs to be added to the product and the product packaging.